Alright, so that video broke it back down. This is about as scientific as we're gonna get in this class, alright? But I want you guys to understand this, okay? So when hemorrhaging occurs, bleeding, that's why it's red, the body releases fibrin, right? That's our clot. When fibrin's released, the body also releases plasminogen and TPA. These two combine to form plasmin, which tears the fibrin, the clot, apart. That's gonna cause increased bleeding, right? Plasmin is a vital enzyme present in the blood that plays a critical role in fibrinolysis, which is the process of breaking down blood clots. Like I said last week, the body's almost confused, right? Do I clot or not clot? Right? Because part of my body's like, I don't want clots, it's not good, it's gonna cause an embolism. But the other part of your body's like, I have to clot or else I'm gonna bleed out. Okay? So TXA stops that whole process, right? It binds to the fibrin and it clots. It stops all of this from happening, okay? So TXA is like tape. We really break it down. Alright? So I need 1, 2, 3, 4, 5, 6 people over here, I don't care. Come here. 6 people. So up until now, you guys have probably been taught what if we have a bleed, what do we give up until now? What have you guys been taught? Just fluids, right? Okay, well now we're gonna make it real simple as to why we don't wanna give fluids unless it's our last option, okay? But like I said, you guys all have whole blood and TXA on the BC truck, right? And pretty much everybody down here in the Tri-County area has access to blood, okay? So let's make it super, super simple. You have
Is
blood,
TPA what they give in the hospital when you're having a stroke, or if it's like within that time frame?
yes, correct, right? So what's that gonna do if we're having a stroke and I get TPA, what's that do?
You're gonna
Good, 'cause that's what I want in that circumstance, right?
Oh,
But it's like the Hail Mary, you know, given certain conditions, right? Certain
I'm
time.
given that when I know I have a specific clot that I found in the CT that I have to break up, right? Because in a stroke, we have a clot that's doing what? It's
Blocking blood flow.
right? It's the embolism is blocking blood flow, right? And it's cutting off perfusion to the brain. So in that situation, yeah, I definitely want to get rid of the clot. But in trauma, I need the clot, right? Because if I don't clot, what happens?
I'm gonna bring that.
Exactly, perfect. Alright, who wants to do the blood?
I'm just shaking it.
Sure. Who wants to be saline? Here you go, doctor. Who wants to be my mechanism of injury? Alright, who wants to be TXA? Who wants to be the bucket? Alright, Thor, you're gonna be the liver. Pour me some blood into this liver, please don't stain it. Just do it like that. Alright, seal it up.
I wish it was more gentle.
There you go, Ezra, get that tape right. Oh, wow, that's good right there. Whatever you need.
By any means necessary.
Alright. Bring that bucket right here in the middle. I'm gonna try to make sure we get all this. Okay, alright, liver, come here. Stand right there. Face the camera. Alright, so you got your liver, right? Now I have my mechanism of injury come in. What do you want it to be? Gunshot, stab? Stab the liver. Where's the liver located?
Right up the corner.
Right, alright, good. Alright, so give me a small cut right in the corner and hold it over the back so it bleeds into the back. Good, alright. So we've got our blood, right? Hold that up a little bit, it's okay if it's on the ground. Hold it up, show it to the camera. I got a towel, you're good. All the way, all the way, all the way. we got arterial bleeding, we got a liver bleed, whatever, right? How can we fix this right now? All we gotta do is stop the bleeding, what do we need to do?
That's it.
Good, what's tape? TXA, alright, put that on there.
Same as
But first, actually stop, before we do that. Normally, before we had TXA, right? What would we give? Saline, good. Alright, so squeeze some of that out into the bag, just so it gets a little out. Alright, good. Now open it up. And this would be our 20 ml a kilogram of normal saline. Back in the day, this is what we did, right? Well, what's that really doing? It's diluting, right? We're just washing them out, correct? Makes sense? We still got a bleed going. You're fine, I got it all, we're good. Let's stay in this thing. So we're really not fixing anything, right? We're giving them more volume, but we're not really fixing our problem. Alright, so now let's throw that TXA on.
Put it in the book.
Alright, so we've clotted it. Doing a pretty good job, right? We got the clot going. We've stopped what process? Fibrinolysis, right? We've stopped fibrinolysis from occurring. Now there's no more of that breakdown of the clot. We've got our clot going, but we still have lost a lot of what? Blood, right? So we need more. Good, so open the liver up. Pour me in some blood. Good, now we're fixed. Okay? So what do we give if we have a major bleed? TXA whole blood, look what we did, we stopped the bleeding and we've administered more blood, so we have more volume, everything's perfusing, right? Super simple. That's the dumbest way I can break it down, alright? So do we give normal saline anymore in here?
No.
Right, that's our last option, if for some reason we didn't have blood or TXA, but we have blood and TXA, so now we have no need for normal saline. That's how we fix our bleed, alright? Good job, you can dump it all in there. See,